Pulmonology is a branch of medicine that focuses on the diagnosis, treatment, and prevention of respiratory diseases. Within this field, one emerging technique that has gained significant attention is bronchial thermoplasty. In this script, we will delve into the various aspects of bronchial thermoplasty, including its mechanism of action, patient selection criteria, procedure details, safety considerations, efficacy and long-term outcomes, management of post-procedure symptoms, its role in severe asthma phenotypes, its alignment with asthma management guidelines, cost-effectiveness and health economic considerations, emerging technologies and future directions, as well as case studies and clinical decision-making related to this procedure. Bronchial thermoplasty is a minimally invasive procedure that aims to provide long-term relief for patients with severe asthma who are unresponsive to traditional therapies. This technique involves delivering controlled thermal energy to the airway walls, resulting in the reduction of smooth muscle mass, which is a characteristic feature of asthma. By reducing the amount of smooth muscle, the airways become less susceptible to constrictions, thus improving asthma symptoms and overall lung function. During bronchial thermoplasty, radiofrequency energy is used to heat the airway walls, which leads to the disruption and destruction of the smooth muscle cells. This process, known as thermal remodeling, induces a reduction in the airway smooth muscle mass and a subsequent decrease in airway hyperresponsiveness. By targeting the smooth muscle layer, bronchial thermoplasty aims to alleviate symptoms associated with bronchoconstriction and improve overall respiratory function. Patient selection for bronchial thermoplasty is a crucial aspect of the procedure. Generally, this technique is reserved for patients with severe asthma who remain symptomatic despite optimized pharmacological therapies. Candidates for bronchial thermoplasty undergo careful assessment, including detailed medical history, lung function testing, and bronchoscopic evaluation. Proper patient selection ensures that the benefits of the procedure outweigh any potential risks or complications. The bronchial thermoplasty procedure is typically performed under conscious sedation or general anesthesia. The bronchoscope is introduced into the airways, allowing visualization of the bronchial tree. A specialized catheter, equipped with an electrode array, is then navigated through the bronchoscope and placed against the airway walls. Controlled thermal energy is delivered in a sequential manner, treating different segments of the airways. The procedure is usually performed in multiple sessions, targeting different lobes of the lungs. Although bronchial thermoplasty has demonstrated efficacy in improving asthma symptoms, there are certain safety considerations that need to be taken into account. Potential complications of the procedure include bronchospasm, transient increase in asthma symptoms, coughing, wheezing, and rarely, airway wall edema or bleeding. These risks are mitigated through careful patient selection, appropriate pre-procedural assessment, and close monitoring during and after the procedure. Multiple clinical studies have evaluated the efficacy of bronchial thermoplasty in patients with severe, uncontrolled asthma. The results have consistently shown improvements in asthma-related quality of life, reduction in symptom burden, decrease in asthma exacerbations, and improved lung function. Long-term follow-up studies suggest the durability of these outcomes, with sustained benefits observed even several years post-procedure. Following bronchial thermoplasty, patients may experience transient symptoms such as chest tightness, cough, and shortness of breath. These symptoms are managed through the use of bronchodilators, systemic corticosteroids, and supportive care. It is essential for healthcare providers to educate patients about the expected post-procedure symptoms and provide appropriate guidance on when to seek medical attention. Severe asthma is a heterogeneous condition, and specific phenotypes may benefit more from bronchial thermoplasty than others. Studies have indicated that patients with an increased proportion of smooth muscle mass in their airways, known as the ASM remodeling phenotype, tend to respond better to this procedure. Identifying and targeting such phenotypes can aid in personalized treatment strategies for patients with severe asthma. The inclusion of bronchial thermoplasty in asthma management guidelines has evolved over time. Current guidelines recommend considering this procedure in patients with severe asthma, after the failure of optimal medical therapy. It is essential for healthcare providers to stay updated with the latest guidelines and incorporate bronchial thermoplasty appropriately into the overall management plan for severe asthmatic patients. The cost-effectiveness of bronchial thermoplasty has been evaluated in several studies. While the initial procedural costs may be higher compared to traditional asthma therapies, the long-term benefits may outweigh these expenses by reducing exacerbation rates and improving quality of life. However, healthcare systems need to consider the overall economic impact of adopting bronchial thermoplasty and weigh it against other available treatment modalities. Advancements in technology and ongoing research have paved the way for potential improvements in bronchial thermoplasty. Techniques such as targeted delivery systems, enhanced imaging modalities, and refined energy delivery algorithms are being explored to further optimize patient outcomes. Additionally, the identification of novel biomarkers and phenotypes associated with treatment response may enable personalized approaches in bronchial thermoplasty. Examining case studies and real-world scenarios is invaluable in understanding the nuances of clinical decision-making in bronchial thermoplasty. By reviewing individual patient characteristics, treatment outcomes, and potential challenges, healthcare providers can enhance their ability to select appropriate candidates, predict treatment response, and manage post-procedure care effectively. Bronchial thermoplasty shows potential as a treatment for severe asthma. Understanding its action, patient selection, procedure, safety, and long-term outcomes is crucial. Health providers should consider guidelines, cost-effectiveness, emerging technologies, and case studies to enhance outcomes in severe asthma patients.